Alagille syndrome is a rare genetic disease with an estimated prevalence of between 1 in 30,000 and 1 in 70,000 births. In the vast majority of cases, it is caused by a mutation in the JAG1 gene, that is, an abnormality of the JAG1 gene, or much more rarely, by a mutation in the Notch2 gene. In exceptional cases, no mutation can be identified. In Alagille syndrome, most often, in just over half of the cases, the mutation arose spontaneously in one of the parent's gametes before fertilization, that is, before the sperm and the egg fused, or in the very first stages of embryonic development after fertilization. In both situations, this is called a de novo mutation. Less frequently, the mutation is inherited by the child from one of the parents who may be more or less symptomatic. Alagille syndrome is a dominant genetic disease, meaning that the presence of a mutation on only one of the two copies or alleles of the gene is enough for the disease to occur. The clinical expression of the disease is highly variable within the same family among individuals carrying the same mutation. The JAG1 and Notch2 genes play a very important role in the development of many organs, which can therefore be affected in Alagille syndrome. This is referred to as a multi-system disorder. The organs and systems that may be affected include the liver, chronic cholestasis, the heart, pulmonary artery stenosis, tetralogy of Fallot, the face, broad forehead, widely spaced eyes and small pointed chin, the skeleton, so-called butterfly vertebrae, bone fragility, the eyes, notably posterior embryotoxon. To establish the diagnosis, at least 3 of these 5 major clinical features must be present. Other anomalies may also be associated, involving the arteries, kidneys, or ENT system. The diagnosis of Alagille syndrome can be difficult to make because of the variety of clinical manifestations. The organs affected differ greatly from one person to another. This is referred to as a genetic disease with variable expressivity. The liver is the organ most frequently affected. This liver involvement is due to abnormal development of the bile ducts and is characterized by a reduced number of bile ducts inside the liver. This is called bile duct paucity. Bile then stagnates in the liver, causing cholestasis, which over time leads to liver damage. This cholestasis often appears within the first days or weeks of life. It is responsible for prolonged jaundice, sometimes with pale stools and dark urine. Itching, called pruritus, sometimes very intense and disabling, linked to high levels of bile acids in the blood. Bile acids are the detergent components of bile. Sometimes xanthomas, which are deposits of fat under the skin linked to high blood cholesterol levels. Deficiencies in fat-soluble vitamins, particularly D, E and K, but vitamin A levels must also be measured. These deficiencies can cause coagulation disorders, K, that may occur early, neurological impairment, E, or contribute to bone fragility leading to fractures, D. Cholestasis can also contribute to growth delay, which is very common in children with Alagille syndrome. These symptoms, particularly pruritus, as well as other symptoms linked to involvement of other organs, not detailed in this video, can have a very significant impact on the quality of life of affected children, notably on sleep, development, schooling, and sometimes mental health. If the liver disease progresses to cirrhosis, or in some cases, when despite medical treatments the quality of life is too severely affected because of cholestasis, pruritus, fractures, growth failure, xanthomas, a liver transplant may be necessary. Children and adults with Alagille syndrome require lifelong multidisciplinary medical follow-up in a hospital program specialized in rare liver diseases. If newborn jaundice persists after 15 days of life, conjugated bilirubin must be measured. In case of newborn jaundice, it is essential to check the color of the stools. If the stools are not bright in color, it means they are discolored. Normal stools are bright in color. Abnormal stools are pale in color. In the newborn, jaundice plus discolored stools plus dark urine equals urgent medical consultation. A conjugated bilirubin test must be performed and a vitamin K injection may be necessary.